We give them crisis intervention training to our police officers. We increase the areas where you could dispose of the drugs. We passed that. As you talked about, Ron, we passed something about 7 days, that you can only prescribe opioids for 7 days in certain circumstances. And I have a few bills about how to have certain preventions. And what they do in Florida is the judge can actually force the person that comes before them to take a product that gets them off of drugs, that weans them off. One is like a Vivitrol. Vivitrol, you take it so you can get off of your addiction. Methadone is something as well, although methadone also has addictive personalities, so people can still get addicted to methadone. But what we're trying to do is make sure people are off of their addiction after they go to court. So in Florida, they force them, they test them to make sure that the product is in there. I have some legislation that I'm working on that. And the other thing I have is to have insurance companies offer the option of covering what they call abuse deterrent drugs. What does that really mean? That the insurance company has to offer one of these other types of products, so that you're not only getting the Oxycontin and the oxycodone and the hydrocodone and these things. Right? That's a good thing, except sometimes the insurance companies, they fight back saying, hey, why should we cover all these things? Just give them the other stuff. But because it's such a problem, we have to have insurance companies also cover the other drugs, so that we're not in the situation we are. This is a major problem, and it affects families. It's taking lives. The judge, she probably deals with them all the time. How much does that cost us as taxpayers? The hospitals are dealing with it all the time. Healthcare system, how much does that cost us as taxpayers? Police are coming out. But as a community and as families, as parents, as brothers, sisters, that's where it really affects us, because lives are being taken. So thank you all. Make sure you pass along the information of this great panel.
Thank you. Thank you, Congressman Kester. Just wanted to ask you, where do you think Michigan stands nationally in regards to the drug epidemic? I know it's worse in New Hampshire, for example. Where does Michigan stand?
I don't know exactly where we stand, but we're not in a good spot.
What are we?
15. We're 15 in the country. We should be the best. We should not have this issue. We should do the best we can to have the lowest overdose rates. That's what our goal is. And it has to be incumbent on everyone. The pharmaceutical, like I said, whose fault is it? The pharmaceutical companies have to do their part. The pharmacists, the doctors, the rehab centers, legislators like myself, community members. If we don't all work together and it becomes fractured, we will continue to have this problem, and it will get worse.
Do you think the solution is because we're not strong enough on drug dealers, or is it because there's not enough laws, or do you think we should create more treatment programs?
A lot of those. We are tough on drug dealers, I think, overall, but we also need more rehab centers. So one of the things I do right now is I chair a committee called CARES, Community Access, Rehabilitation, Education, and Services. And we're looking at creating policy to have better rehabilitation settings. Because sometimes somebody will go to a rehab center or they go to jail, and then they'll have a couple months where they haven't gotten into the next program, and that's where they go back onto their addiction. And by the way, you know, when people go to these rehab centers, you don't just, and they come out clean, don't just assume that they're good to go and everything is fine. They still need the support, they still need the services, they still need your help. Because otherwise they will fall right back into their addiction. And the judge can tell you, for sure, how many people she sees that come back after an addiction, they beat it for a short term, 1 year, 2 years, few months, whatever it might be, and then they're right back.
Thank you. Does anyone have a story they want to share or a question?
Hello, everyone. As a pharmacist, I've seen people call me, and I have a foundation also, the charity foundation. I think the problem is not the pharmaceutical company. We barely dispense any narcotic at my pharmacy. We just give them to patients that need them. They're getting it from the street. Has to be more control and strict rules. And I have a lot of kids, they've been on probation, and they went to jail 1 to 2 days. Family called me to seek help, and I have personal stories. And also the internet. They're getting the drugs, narcotic from the internet. Should be more control system. I like the MAP system, we use it at my pharmacy, but the street drugs is very hard. And what about the marijuana? If the system is wrong, how could you legalize the marijuana? 90% of our children are not using heavy, drugs like, they're using the marijuana. Almost every family have problem with that. And they tell us it's okay, it's like cigarette. If these kids have something called card or something, I guess they call prescription card or something, allow them. And some other states, everybody's using it. Sometimes I go to California, Los Angeles, and the streets are like stinks. And I think the problem is our kids are they claim they are depressed, and they have excuse to use marijuana because they said it helps us. And they said the prescription item fell, and they feel a lot better. Or they use it to treat their other symptoms, sorry. So my point is marijuana is the #1 problem, and that could lead to other issues. So it should be controlled with the internet. People are buying drugs from internet and from the street more than pharmacy. I don't think I have any problem, let's say. A lot of pharmacy are very strict with selling the drugs. So you can help us with that, please. Thank you.
Thank you.
وين الجفرمنت وين الاف بي اي وين البوليس لما يشوفون المناطق اللي قدام عيونهم they يبيعون الدراجز in front of their face and nobody can control whatever she say. The pharmacist is not like the pharmacist. Some pharmacists they don't blame the pharmacist because the pharmacists they are very strict. I got one story. I got two family رحت عندهم بالبيت اني شفت انهم مفرغين البيسمنت ويزرعون والاولاد يعلموهم شلون يقصون الزرع. فلما يقصون الزرع دا اسال الام والاب كيف يعني الاولاد راح يتربون. امريكا دا تروح داون اند داون وخطره. شلون دا تعلمون اولادكم انه يقصون الحشيش والبيت كله معبر بهيك قضايا. سالت جاوبتني قالت لي what do you think؟ انت راح تدفعين بيمنات البيت مالتي؟ يعني do you believe it؟ يربون اولادهم ماكو دراسه، ماكو ثقافه بعد، ماكو تخرج بعد، انه يربون اولادهم هالتربيه حتى ينشؤون نشأه. مع الاسف هسه نشوف احنا اللي يصير احنا هنا بالبلد كله التدهور وين الكنترول؟ يعني تقول لي انت تدفعين بيمنات مال بيتي، يعني واحد ما يقدر يحكي وياهم بهالطريقه الاسلوب. يعني أنا أتأسف كثير، يعني 5 6 شباب يروحون بعز الورود يروحون يموتون بدقيقة واحدة من نتيجة الدركس، ووحدة راح لها ولد وبالتعزية أنا قاعدة بالتعزية قالت أوه ابني سوى لنا مستقبل مع الأسف وراح. إيش مستقبل؟ كيف ترضين أنت ابنك يروح وأنت تقعدين في بيت بالملايين وتسوقين سيارة مرسيدس على سوالها ابنها مستقبل بس خسرت ابنها. يعني هذه اللي أنا أتألم من عنده، إنه أريد إنه المجتمع مالتنا ياخذ عبرة من اللي يصير والباقي بيد مثل ما يقولون الاف بي اي ولا البوليس ولا الجفرمنت nobody care يعني في قضايا. Thank you very much.
Thank you.
Hi, my name is Simon Jonah. I have a question from the crowd, and I think it likely applies to one of the physicians, either Dr. Francis or Dr. George. In terms of leading indication, how is it that you decipher, distinguish, discern between the conventional faculties of depression in contrast to drug-induced depression?
Okay, so the problem with opiate dependence lies in the fact that there are personality issues that lead to the opiate use or any substance use. It can be ADHD, it can be social anxiety disorder, it could be any anxiety, it could be depression. As we know, depression does not lead to the use of alcohol. Alcohol leads to depression. So you have to really tackle these personalities, and you have to find out what they are, and you can approach the professionals on how to, proceed with the treatment of these personality disorders. So, also I want to comment on one issue regarding the opiate use. Oral medications or oral opiates versus nasally used opiates or intravenous use opiates. These routes of administration, whether it's nasal or it's intravenous, it's very addictive, very reinforcing. So any person that uses that kind of a route, their problem is really deeply rooted. As I said, opiates cause damage to the brain, and it's hard to revert that damage. It can be taken care of, it can heal by not using opiates. It takes about probably 1 year to 2 years and maybe 3 years not using opiates for that brain to heal, so that you get away from this like addiction. Addiction is a chronically relapsing disease, as we said. So the person, there's no really one single treatment and then the person is cured. It can relapse. So that's why I think abstinence model with use of naltrexone, blocking the opiate receptor, is very important. And then dealing with the personalities that lead to that type of approach.
And just for a clarification, what we're talking about here is the opioids, which is marijuana is not an opioid, right?
It's a substance.
Correct.
It's a substance. It's different than what they're talking about with the pills and the heroin. Just like cocaine is also different, marijuana is different, alcohol is different. How did we get marijuana? People call it they name it a gateway drug. If you use marijuana, you'll go to the next thing and the next thing and the next thing. Okay? Marijuana used to be illegal until 2008. It became legal from a medical standpoint. Medical marijuana. How did it become legal? It became legal because somebody put it on the ballot in November of 2008, and the majority of people in the state of Michigan voted in support of it. That's how it became legal. What did the state of Michigan do? Because everybody's growing in their basement and this and pushing it off, whether it's clean or dirty or not. Because it's medical, it's already legal from a medical standpoint. And they had all these houses out there, and nobody has any control. They passed laws to control it. What will probably happen in 2018 in November is that someone else will come, get signatures. You could probably see them all over the place, getting signatures to put marijuana completely legal on the ballot in 2018. If you do not support it, here's my suggestion. Get registered and go vote in November. So if I was just telling Ronnie this, if somebody came out with probably a proposal that said we're going to make cocaine legal or heroin legal, and the people vote in favor of it, the law would change. Why is that important? Why am I saying that? Because that's how important it is to vote. That's why. People are wondering, why is marijuana everywhere? Medical marijuana and all this. Because in 2008, the people of the state of Michigan voted in favor of it. And you're going to see it again probably in 2018 to make it completely legal. Nothing that I can do to stop that. Because they go out and they get so many signatures, put it on the ballot.
Can I add to that point really quick? So here's the thing though, please keep this in mind, that a dose of marijuana, generally speaking, is not going to put you into respiratory depression. The issue that we face today with the opioid epidemic is this. Because of the fact that heroin is being laced with those powerful opioid drugs, one dose is all it takes, and within seconds, somebody can stop breathing. That's all it takes, within seconds. So please keep that in mind, that that's why we're so aggressive in attacking this. That's why so many people are dying right now. That's why so many people are getting admitted to emergency rooms for that reason. Because of the fact they stop breathing if the drug is too potent. They don't know what they're injecting. So we gotta make sure that we clarify that distinction.
Regarding to the use of marijuana, I can elaborate to some degree. Basically, especially in young kids, if you guys use marijuana around the age of 12, 13, 14, it will reduce your IQ by 8 points. That's not good. You will probably become a high school dropout. You won't have a good admission to the universities, or even if you are in the universities, you probably are not going to finish. And there are some other issues with the marijuana. You know, your magnitude of losses that you appreciate is not well assimilated. So there are some issues with marijuana. Essentially, I tell my patients, when you use marijuana, you become dumb and dumb. Simple.
I have a question here.
Hello, my name is Najib Jadan. I'm a real estate agent, and I would like to ask Mr. Custo a question. The question is, we have gun control, we have liquor control, why can't we get marijuana control? Let it run by the government or some manufacturer instead of going through people's basement. They own it, making money out of it.
Yeah.
I don't mind, it's okay making money, but let it be controlled and do it the right way.
So there
Can
is,
they do it like liquor control?
yes, they will be.
How soon?
They are in
After
the
they kill
process
so
right
many
now.
people and everything?
What's that?
After so many people, they're gonna die because of this?
No,
and
marijuana is different. Again,
It is different, I
but
understand.
as far, to answer your question, there already is a board like the Liquor Control Commission in place that is setting up the rules.
How long is it gonna take? They've been selling for 2 years.
1 month.
1 month?
Yeah.
Okay. Well, I like to see that because it'll be a whole lot easier for the store owners to get it. Like how we get our liquor, we get it from liquor control, from their stores, and that way everybody can get it from the government. Thanks.
Just my understanding, there is number of plants that's allowed, not you can plant any numbers, 10 or 8, that's my understood. Well, at least in Detroit.
Just to get back on the pain addiction question.
Just wanted to add to Dr. George, genetics play a role too in addiction, and there is a lot of research about that. Second, I have a plea to the dentist in the room for dental extraction. They prescribe 90 tablets of pain medication. We know that the pain may be disappearing in a day or two. I plead to the parents to hide their medications for the mothers and their grandparents from children. They steal a lot from the cupboards.
Question for Ronnie. The patient buy narco or Vicodin cash from the pharmacy, his name will appear on map?
It will. So what happens is this, is that regardless of insurance payment, regardless of what it is, what MAPS is stands for the Michigan Automated Prescription System. Every pharmacy uploads it to the state of Michigan. It's required. Any controlled substance gets uploaded, and the next day the physician, the pharmacist will be able to see that information. It is available to any healthcare professional. The problem is that, again, remember what I said, 31 to 40% of doctors right now are registered for MAPS. We're trying to change that. Not everyone is checking it. Pharmacies in general are further ahead. Majority of pharmacies today are registered for MAPS. But if you think about it, it's a great tool because if Ronnie goes to a doctor today and I obtain Norco, if I then go to another doctor and say, you know what, my back is hurting, can you give me more? That doctor should be able to say, look, Ronnie, you were just at a doctor yesterday. I'm sorry, I'm not going to give you more pills. Remember that problem I said, only 40% of doctors in the state of Michigan are registered for MAPS today, and that is a problem.
Thank you. Does anyone have a success story where they knew somebody that had Vicodin or Norco addiction and they got them out of it? Could be from the audience or it could be from professionals.
So I am a parent with a son in long-term recovery. For him, that means he has not had a drink or a drug since October 26, 2012. Prior to that, though, is everything Judge D'Agostini has shared, everything our panelists have shared. His started with an innocent tonsillectomy and a prescription of Vicodin. And he was very functioning. He was the MVP soccer player, very well-liked young man. So there are kids, there are neighbors, they're everyone we love. I did bring someone with me tonight who is a person in recovery. Her name is Kate, and I'll let her share. She didn't know she was going to do this.
I'm a person in recovery. My recovery started, I'm over a year clean from heroin now. I was a teacher, high school teacher, chemistry teacher in Macomb County. And when I was in college, I had dislocated a hip. And I was prescribed all kinds of narcotics. And eventually, that led me to heroin. And February 11, 2016, I overdosed on carfentanil, and I fell out for 16 hours and nobody found me. When I got to the hospital, I had compartment syndrome and kidney failure, and I had to have my right arm amputated. So I am the face of the opiate addiction, and it's more prevalent than you think it is. I was highly functioning, I worked, I was in graduate school, I was a teacher, and I'm lucky to be alive today. Thank you.
I want to thank you for your courage. Any from our panelists want to follow comment?
This is not a comment to that, but I would like to say, and just as a notice, Ronnie Fumé and I, along with Sheriff Michael Bouchard, will also be doing a town hall on December 7th from 6:30 to 8:30 at the Commerce Township Library. Everyone's welcome.